Okay, well, it's a topic not many people like to talk about. Constipation certainly affects many of us. It's one of the most common gastrointestinal complaints in North America. Registered dietitian Andrea Holwegner is here to help. I guess the first question to ask is, why do people get all bunged up?
I know,
why do we get
this
constipated?
is a great topic for a Monday morning. You know, constipation can happen for a variety of reasons. So when we look at normal digestion, when food goes through the normal process of digestion and goes through the digestive tract, there's little peristalsis, little waves, muscle contractions that are squeezing foods through. And once it hits the large intestine or the colon, then water and electrolytes start getting absorbed. And so if it starts to sit there a little bit too long, then it concentrates and gets really hard and difficult to pass.
Okay, so then I have to ask then, what's the normal poop?
This is a big discussion topic in our office, surprisingly enough. We talk about this lots as dietitians. So when we look at what normal bowel movements and routines look like, of course something that's soft, and contrary to popular belief, it doesn't necessarily mean you're going to have a bowel movement every day. And so for some people, anywhere between, we say, like 3 times a day up to 3 times per week would be considered normal. The key is just making it soft and easy to pass. If it's hard and painful, then we got some constipation.
If you're grunting in the washroom, that's not a good thing. Okay, real quick before you show us some foods we should be eating, who is most likely to suffer with constipation?
You know what? Women more often than males. Pregnant women, I can certainly relate to that because everything, you know, when I was pregnant, everything in your system changes and things start to slow down. I became fiber obsessed when I was carrying my son because things really do shift. And we know that when your schedule shifts, so when people are traveling and their regular routines are shifted, stress management, huge role. I always say the brain and the gut are very connected. When one gets stressed out, the other does too.
And as I was saying, this might be too much information, but when I traveled to Asia a couple years ago, oh my goodness, there was nothing that can help me. Okay, but you're gonna help us. You're gonna help us right here. So what should we be eating? You have, let's just start here on this side and just show us what we should be having just to make sure that we stay regular. And if we are constipated, how can we treat it?
And even before we get into fiber, the biggest thing, your gut likes routine. It does not like meals all over the place and sporadic eating. It likes to know that there's a real predictable amount and levels of food coming through your day. So that's number one.
So beans, of course.
Beans, of course, when we think of fiber, you know, these are definitely some of the highest sources of fiber. Your, regular canned beans and tomato sauce, lentils, chickpeas. You know, people always think of prunes, but all dried fruits tend to be pretty good.
When you go on a cruise ship, they leave a prune on your pillow for you.
There you go. They're trying to keep people happy. When people are constipated, they are grumpy.
They are. And fruits and vegetables, of course, here.
One of the most common reasons people are constipated is they just simply do not get the volume of fruits and veggies in every day. So when we're thinking of veggies, I always tell people use what I call the 2x2 rule. 2 different types of veggies twice a day. Good rule of thumb to have in the back of your head. Top fiber sources for veggies, of course, are your broccolis, peas, even regular like frozen peas in a bag that you might feed your family. Fantastic, one of the best sources of fiber.
And then of course we have our grains too, right? Very important. Quinoa, I have all this stuff.
And one of the other most common reasons people are constipated is there's so many people taking grains out of their diet for no reason, from a health perspective. From a weight management perspective, just not necessary, and certainly affects digestive health when you get rid of all this great brands and roughage out of your diet.
And then you were saying that, yes, it's so important to eat all of these foods, but if you're not drinking enough water, that can really get you backed up too.
You got it. So sometimes when people we're working with them on constipation, they get the fiber going and they come in and they're like, I'm dying of pain. And then the next question is, why are you getting 2 to 3 liters of water in a day? If you're struggling with constipation, the fluid is as important as the fiber.
Of course, always great to have you, Andrea. Oh my goodness, now you know, right? If you are having some troubles in the toilet, this is all you got to do. Okay, again, thanks to our registered dietitian, Andrea Holwegner. For more information on this or other topics, you can check out healthstandnutrition.com. We're going to toss it over to Kelsey for the weather. Kelsey, again, weird segue.
I really don't know how I follow this. I think best piece of advice from our Kathy Lee, if you're grunting in the bathroom, that's not okay. That's what I've taken away from this segment. 8:22, good morning. We're sitting at 10 degrees.